Now, in the last section, we had a brief introduction to selection bias and we tried to understand how it can affect causal inference. Now, in this subsection, let us look at how selection bias affects causal inference that is made from case control studies. Now, we all know that in case control studies, an outcome-based selection happens, which means people who are selected into your study are selected because they have a certain outcome or because they do not have a particular outcome. So the presence or absence of the outcome is what decides on whether a person enters your study or does not enter. This opens up a window for inappropriate selection to creep up and thereby bringing along with it a host of selection biases. This is a diagram that we already saw in the first section. So there is an exposure E, there is a disease D, and C is whether or not somebody gets selected into your study. Now, because it is a case control study, already we start with an arrow between D to C because presence of or absence of disease decides whether somebody gets selected into your study. So the arrow between D and C is already there. So all that is required for selection bias to happen in a case control study is for an arrow to be there between E and C, which is to say, if in any way your exposure also affects selection into the study, then your case control study is certainly going to affect your causal inference. Now let us look at it with a very specific example. Let us say the exposure is hormone therapy and the disease under study is endometrial cancer. Like I said, C decides whether or not a person gets selected into the study. So we are conditioning on C. That is why there is a square box around C. So we are conditioning on C. So let us say in our study, because our outcome is endometrial cancer, the cases are women with endometrial cancer, very specifically postmenopausal women with endometrial cancer. So my controls will be postmenopausal women without endometrial cancer. Now let us say for some reason I was not able to convince apparently healthy postmenopausal women to sign up into my study as controls, and I decided, because another common reason for which postmenopausal women seek help is hip fracture. So let us say I enrolled postmenopausal women with hip fracture as controls. So my cases now are women, postmenopausal women with endometrial cancer, and my controls are postmenopausal women with hip fracture. Now by doing this selection, what I have done is I have not noticed that my exposure has indirectly now influenced selection. My exposure here is hormone therapy, and it is a known factor that hormone therapies reduce the incidence of hip fracture in postmenopausal women. So indirectly, now my exposure is also influencing selection by having an effect on hip fracture. So what has happened now is my controls who are more likely to have hip fracture than my cases are women who were not exposed to hormone therapy. There is going to be fewer controls who underwent hormone therapy because these are women who have landed up with hip fracture, and we know that hormone therapy is reducing the risk of hip fracture. So I am going to have a group of controls who, by virtue of their selection, they have some trait which has lower chances of exposure in them. In other words, my controls are going to have lesser chance of exposure. The odds that they were exposed to hormone therapy are lesser because they are women with hip fracture, and hormone therapy is protective against hip fracture. So in our example, by virtue of having women with hip fracture as controls, we have introduced a selection bias. Because hormone therapy reduces the risk of hip fracture, I'm not going to find many women in my controls who have taken hormone therapy because they have sustained hip fracture. So because of this selection method, I have introduced selection bias into my case control study. Now if you see this DAG, you can see that there are two arrows. One arrow which goes from D to C, which is anyway there because it is a case control study and outcome based selection is happening in this type of study. But the additional arrow from E to C, which was required to introduce selection bias in this case, happened because I put in certain selection criteria. So this is one example of how case control studies can suffer from selection bias. Let us quickly look at one more example, which is a case of Bergson's bias, also called Bergsonian bias or Bergson's fallacy. Now here the exposure is still hormone therapy, but let us say the disease I am looking at here is myocardial infarction. And I am conditioning on a factor C, which here is hospitalization, which means I have chosen to select my cases and controls from a hospital. So this is happening in a hospital-based case control study. Now to choose my controls, all my cases are women with myocardial infarction, postmenopausal women with myocardial infarction. So I thought because I'm doing it in a hospital, maybe another common reason why people seek care, postmenopausal women seek care, is because they have unexplained uterine bleeding. So because I have selected women who have come to the hospital for evaluation of their uterine bleeding as controls, I have chosen them as controls. So I have now started up an arrow which goes from E to C, because we know that exposure to hormone therapy can also affect the risk of somebody having uterine bleeding. So inadvertently, because I did my study in a hospital and I chose my controls from the hospital where women who are seeking care are having bleeding, which is also related to my exposure, I have now opened up a pathway between E and C. Now it has happened again. You have C, you are controlling on C, which means you are having only hospitalized women here. The reason your controls were hospitalized has something to do with the exposure under study. So now you have a collider there, you are conditioning on a collider, and you have introduced selection bias into your study. Now this type of bias that gets introduced by restricting your selection to hospitalized patients is Bergson's bias. So briefly, to talk about selection bias in case control studies, it can happen because of the way you chose to select your controls. There is a third factor that operates there, which opens up a pathway between your exposure and the selection, which means your exposure has now also influenced selection the same way your outcome had influenced selection, because it is a case control study. So in a case control study, we already start with an arrow from D to C, and with that one wrong move in selection criteria, we have opened up a pathway from E to C, and conditioning on C, we have introduced selection bias into our case control study. In our next section, we will talk about selection biases that can happen in cohort studies. Thank you.